Hello. So I'm back with another video, and the topic today is a radionuclide scan. This is just a brief introduction and description about it, a few words about the advantages, disadvantages, etc. So let us see what is a radionuclide scan. So it's also called the radioisotope scan. It is an imaging technique used to visualize parts of the body by injecting a small dose of a radioactive chemical into the body. So that is it. So it's an imaging technique, just like ultrasound, CT, MRI, but here we inject a small dose of a radioactive element into the body, or radioactive agent to be exact. Now, what's the principle? A radioactive element or a radionuclide like technetium, thallium, gallium, or iodine is administered to the patient as part of a radiopharmaceutical agent. So the chemical is not used directly, instead, it is combined with another agent to form a radiopharmaceutical agent, and then it is injected. So these chemicals localize to specific organs and tissues depending on the type of substance used, and then emit gamma rays which can be detected by a gamma camera. So that is the basic principle. So the emissions form an image on a monitor. So different radionuclides are required for imaging of different tissues. So this is the principle in a nutshell. So a radioactive element is combined or complexed along with a radiopharmaceutical agent and then administered to the patient. The chemical localizes to a specific organ or tissue, and then it emits the gamma rays, which is captured by the gamma camera, and these emissions are then converted into an image on a monitor. So what are the uses or the indications for a radionuclide scan? So it is used in bone imaging to assess metastatic disease, metabolic bone disease, occult infections like very occult osteomyelitis, traumatic injuries which cannot be made out in the X-ray or the CT. So that is the one use of radionuclide scan. It is in bone imaging. Second, it's used in genitourinary disease to assess the renal function and the renal perfusion. Third, it is used in assessing thyroid and parathyroid disorders. So, Graves' disease, toxic nodular goiter, toxic nodule, all of these have a different picture when you do a radionuclide scan. It is used in assessment of ischemic cardiac disease, inflammatory bowel disease, and pulmonary emboli. So the radionuclide scan is called by different names depending on which part of the body it is assessing. Then it is also used in the PET scan. Now, what are the contraindications? As it involves a lot of radiation, and radioactive elements are injected, it is contraindicated in breastfeeding as well as in pregnancy. Then also in those who have allergic reaction to the radiopharmaceutical agent. Now the advantage, even though radiation is a side effect, it is relatively safe and it is non-invasive. It allows functional imaging. It allows imaging of the whole body. A bone scan has a high sensitivity for metastatic bone disease and infection. So what is not found out by an MRI or a CT or a regular X-ray, it can be found out with a bone scan. Now the disadvantage is that it is expensive, it's not easily available, and the obvious one, there is a risk of exposure to radiation. Then specific agents are needed for specific indications. And it has got a poor spatial resolution. Now the adverse effects of the radiopharmaceutical agents also will form a disadvantage. So this is how the picture looks like. I've taken one for a thyroid disease on the left side. So you can see that how the thyroid gland looks like, and you can see that the cold nodule is not functioning, so it's looking like a white patch. The Graves' disease, the entire gland is functioning, so you can see that the entire gland is darkened. In toxic multinodular goiter, only one or two nodules are functioning, the rest are suppressed. In the hot nodule or the toxic nodule, that particular nodule is dark and the rest of the gland is suppressed. Similarly for the autonomous nodule. In thyroiditis, similarly, the entire gland is showing decreased function. This is during the phase where thyroiditis are already advanced. On the right side, you have a picture showing multiple dark spots. This suggests a metastatic disease. Thank you for seeing this video. I hope you have got a brief understanding about what a radionuclide scan is. I hope you will be able to share this with other students so they can also get the benefit of these topic-based videos. So thank you for watching.